Good evening and welcome. Thank you so much for being with us today. My name is Joumana Baroody, and I serve as a Vice President of Care Services for ALS United, Illinois, Indiana, and Missouri. On behalf of our entire team, we're grateful you chose to spend your time with us for this important and deeply personal conversation. Tonight's webinar focuses on decisions around invasive ventilations in ALS, choices that can feel overwhelming, emotional, and incredibly complex. These decisions often involve medical realities, caregiving considerations, family dynamics, quality of life, and what matters most to each individual living with ALS. Before we begin, I want to share a brief and important note. The information presented today is for educational purposes only and is not a substitute for individualized medical advice. Everyone's situation is unique, and we strongly encourage participants to discuss personal medical decisions with their healthcare team. Our goal tonight is not to direct anyone toward a particular choice, but rather to provide honest lived experience, clinical insight, and compassionate guidance so people can approach these decisions feeling informed, supported, and empowered, whatever path they choose. Before we get started, I want to go over some very quick housekeeping notes. The webinar is being recorded and will be shared afterwards. Please submit your questions using the Q&A feature at any time. We'll try to answer your questions at the end of the program, but if for some reason we cannot address all these questions, a follow-up email will be sent. The presentation is titled Invasive Ventilation with ALS, a Deeply Personal Choice, presented by Anne O'Sullivan. Anne is a registered respiratory therapist and complex care patient advocate with more than 25 years of experience across hospitals, home healthcare agencies, and durable medical equipment organizations. For the past 14 years, she has worked with Independence Plus, a respiratory company, helping medically complex and technology-dependent individuals transition from inpatient facilities back into their homes. Anne is widely respected for her dedication to educating and empowering families as they navigate complex healthcare systems and advocate for the services they need. Her work is also shaped by personal experience as the mother of a medically complex adult child, an experience that continues to motivate her advocacy and commitment to patient-centered care. Anne, thank you so much for joining us and for the incredible work you do every day. We're so glad to have you here.
Thank you, Joumana, so very much for the lovely introduction. I'm humbled and honored to be asked to be a guest speaker at this presentation. Good afternoon or evening, everyone, depending upon what time zone you're in. I thank you for sharing your time and energy with me today. I know you're all navigating a new and probably challenging reality, and my goal is to provide practical information to help empower each of you to make informed decisions for yourself if you do choose to receive a tracheostomy tube and invasive ventilation. As Joumana mentioned, this is personal to me. My oldest son is 35 years old and was born with a rare genetic disorder. He is medically complex and developmentally disabled. And I feel it's been my life's mission to help each and every individual who reaches out to me to try and navigate this complex healthcare system as it's ever changing. So the title of my presentation, Invasive Ventilation with ALS, a Deeply Personal Choice, is because I personally think it's been a deeply personal choice for me, as my son has started to decline with age, I have been forced to make his decisions with regards to his life care and his health care. And I believe that if you are able to make your own decisions, self-determination is an empowering thing. So again, having the ability to make these choices, have all the information at your hands, and being able to choose the path that's right for you is very important. Knowledge is power. So next. Many of you are probably wondering, what are your options? And I want to just emphasize that the most important thing you need to know right now is you do have options. You might not know what they are and all the different options you have, but you do. And whatever path you choose should be what's right for you, not what anyone else says you should or should not do. Learning what your options are is going to give you the power to make informed decisions. You should be having a proactive discussion with your family and your healthcare teams to find out all the different options there are for you. Probably wondering, what will my health insurance cover if I opt for a tracheostomy tube and invasive ventilation? The short answer is health insurance coverage varies based on your policy, but we'll go further into that later on in further slides. And what will this cost me if insurance doesn't cover something I require? Unfortunately, insurance doesn't cover a lot of things to really make this work. And sometimes there are out-of-pocket costs, especially if you're opting to get a tracheostomy tube and invasive ventilation. Most specifically, or more specifically, it would be for covering private duty nursing if you don't have it as a covered benefit in your insurance plan. You may be asking, well, who will provide my care if I go home with a tracheostomy tube on a ventilator? That's either going to be caregivers or skilled clinicians based on your insurance coverage. And will I still be able to participate in the things that are meaningful to me? Again, that's a deeply personal choice. If you liked to participate in sports, pickleball or softball, yes, you probably will not be playing that at the end stages of ALS or somewhere in your journey. But you may enjoy being a spectator for those sports. There's a lot of advanced technologies where you may be able to still play chess online and other games, but physically, you are not going to have the same level of meaningful activity as you did prior to your diagnosis. But again, this is a personal choice. What happens if I change my mind? Here's the good news. You can change your mind, and you can change it again, and you can change it again, and you can keep changing your mind. It's just important to have the safety net in place when you do change your mind, or if you change your mind, and that's through the proactive discussions with your healthcare providers. Other important considerations is opting for invasive ventilation may extend your life, but it is not a cure. It may extend your life by months or even years, but advanced ALS will continue to occur. Next, health insurance coverage. So very briefly, traditional Medicare A is all inpatient hospital. B is doctor's visits, home medical visits, anything other than the hospital that you require, home medical equipment. And this is a national plan, so it will be the same no matter what state you live in if you choose traditional Medicare A and B and a supplemental. But there are now many Medicare Advantage plans on the marketplace, and I just want to mention that these Medicare Advantage plans are actually run by private insurance companies. So it's like a Medicare HMO. These private insurance set different costs. They have different networks. Oh, sorry. No, we're still on this. Thank you, Betty. They have different premiums, copays, and cover services. And these can vary widely based on the state you live in and even sometimes the county you live in. So many people choose Medicare Advantage plans because for them they are more cost effective. It can offer groceries, some transportation, over-the-counter medications. My personal opinion, and only my opinion, if you can go with the traditional Medicare A and B and a supplemental plan, all the choices are still there for you for who you get to see, who your provider will be. You can go to different states for care and second opinions, where Medicare Advantage plans, you're not going to have as many options. Next. Medicaid and managed Medicaid. So Medicaid is available in every state in the country. 50% of the funding for Medicaid is through federal dollars, and 50% of the funding for Medicaid is through state dollars. Medicaid benefits vary based on the state you live in. So I'm going to reference Illinois because that's where I'm at right now. Medicaid in Illinois does not offer private duty nursing for adults. It's quite unfortunate. If you are over the age of 21, there are no programs, Medicaid programs in this state that offer one-on-one private duty nursing in the home for adults. Managed Medicaid, again, is covered and ran through private insurance. You have less options. You have to go to an in-network provider, and many things vary based on which managed Medicaid provider you choose. Some Medicaid plans will offer reimbursement to family members to care for the member who is covered by Medicaid. The reimbursement is typically nominal and will not be able to afford for that person to be paid for 24/7 care. You can have Medicaid and Medicare, and you can have Medicaid and private insurance. Next. So this is private health insurance, which are your typical HMOs, PPOs, and you can obtain them through your employer or your spouse's employer, or they can be purchased through the Affordable Care Act. These plans are your Blue Cross Blue Shields, your United Healthcares, your Cigna, Humana. The monthly premiums, deductibles, out-of-pockets, copays, and covered benefits vary from plan to plan. So benefits and eligibility should be run for each and every plan before you decide to keep the particular plan or possibly drop it and opt for the Medicare Fast Track. The reason I say that, if you are considering getting a tracheostomy tube and having invasive mechanical ventilation to prolong your life, Medicare and Medicaid in Illinois will not cover private duty nursing. The only place you're going to find it is in these HMO plans and PPO plans. Some of them are in the employer-sponsored plans, but there are many plans through the Affordable Care Act that do cover private duty nursing benefits. I just want to mention, if it is a covered benefit in your plan, there's no guarantee that it will be approved. Quite frankly, most of the insurance companies don't want to approve this benefit because it's quite costly to them. Health insurance companies want healthy people. Life insurance companies want live people. That's just the way the industry is. So if you're going to try and go the route of a tracheostomy tube and invasive ventilation, and you have a private duty nursing benefit, you need to find a provider who can submit the necessary paperwork to activate the benefit. The threshold for medical necessity to activate the benefit is having the presence of a tracheostomy tube and invasive ventilation. After an initial period of anywhere between 3 months, 6 months, and a year, if the private insurance company has approved this benefit and you're home and you're receiving your one-on-one private duty nursing and things are going well, eventually the private insurance companies will issue a denial and deem your care custodial in nature. There are 3 levels of appeals that you can go through to try and have this denial or adverse determination overturned. The appeals process can take weeks or months, and there's no guarantee that the denial will be overturned. But again, I've been doing this for quite a long time, and I've never seen many decades, as Joumana mentioned. I've never seen such a difficult landscape to navigate to get these benefits approved and to keep them approved, and each year keeps getting more and more challenging. I'm not trying to dissuade anybody from going this route. I'm just trying to say what I'm seeing in the marketplace right now. Next. So there are financial considerations, as not all the services or products that you may need to transition home and live with a tracheostomy tube on invasive ventilation will be covered by your insurance. The coverage, again, is based on the payer. Benefits and eligibility vary from one policy to the next. Finding out that information proactively is a good thing to do. So alternate funding sources to pay for any product or services that you may need or want would be trusts, annuities, investments, long-term care policies, savings, and reverse mortgages. What I'd like to say right now as a disclaimer is, please don't tap into any of those things without first consulting your financial advisor if you have one, or your financial power of attorney in your family before you opt to go into those funding sources, alternate funding sources. Next, we'll talk about caregivers. In Illinois, a person who's going to return home on invasive mechanical ventilation requires a minimum of 2 trained caregivers to transition home. One of the trained caregivers must live with the patient, or the patient must live with the caregiver in their home. And the second trained caregiver must live within a reasonable driving distance from the patient. They can't live in another state that requires a flight or days of driving to get to them. All identified caregivers must receive education and training from the durable medical equipment company that will be providing the ventilator on all aspects of the patient's care, including the mechanical ventilator. Caregivers must demonstrate competency on all aspects of the care, and in Illinois, they must all be aged 18 or older. There can be a consideration given if someone is 17 and going to be 18 in a couple of months, type of thing, if there's a child. So I personally, again, after decades of doing this, believe it's unrealistic to think that only 2 people could provide 24/7 care to a person who has invasive mechanical ventilation with a tracheostomy tube. That would require each of those 2 trained caregivers to provide 84 hours of one-on-one care each week. And I think a lack of appropriate caregiver support leads to more frequent patient hospitalizations, because we're all humans and people get burnt out and they get sick and they have to go to the doctor themselves. So it just does not seem realistic. It is the minimum requirement in the state, but I think a realistic number of caregivers would be 4 or more, unless you're hiring private duty nurses. Then that's a different subject. And the caregivers should have reliable, skilled home health care providers to support them in the home. While we all may want to provide all the care to our loved ones, myself included with my son, it's easy to overestimate or underestimate our abilities. And I know personally, I had my son at home for 26 years, and I had hired caregivers. And then as they fell off, I had to find new ones and continue working and caring for my other 3 children. And it did get to the point where, quite frankly, it was too much. And I thought I was Superwoman, and I helped no one. My health declined. My son's health declined. Again, just my personal story that I'm sharing with you. So caregiver burnout and stress is real, and it does impact patient outcomes. Next. Lifestyle. So considerations when choosing a tracheostomy tube and invasive ventilation. Your personal values, quality of life goals, your caregiver availability. Do you have a private duty nursing benefit? Your ability to pay for services or products that won't be covered by your health insurance, and your potential life extension. Choosing a tracheostomy tube and invasive ventilation can add months and years to your life. It won't stop the disease progression. Again, it is not a cure. And there are other options that could be taken, like palliative care, hospice care. It is a deeply personal choice. And I know my own opinion for myself, but that's me. I'm a couch potato. I could watch TV all night long, and I'm very happy to do so. But that's not for everybody. So you have to really take a look at what is important to you and what you're going to be happy living with. This is your life, and these are your decisions to make. So just to review, unfortunately, the gaps in our healthcare continuum usually show up when there's a crisis. So an accident, an injury, or a diagnosis such as ALS generally are the times when people take stock in what they have and what they need. And proactive approaches to getting things in place will help alleviate some stress from your lives. You have to balance your desire for more life with the realities of living with advanced ALS, because yes, you will live longer with the trach and invasive ventilation, but do you have the personality that you will be comfortable living with advanced ALS? You have to accept that you're going to require 24/7 care. first of all, is it feasible? Do you have a private duty nursing benefit? Do you know enough people to provide the care? And secondly, will you be comfortable with having people in your house all the time? Again, beating a dead horse, I apologize. Invasive mechanical ventilation will not stop disease progression. There are other things you can do, like starting non-invasive ventilation or the use of a respiratory assist device, more commonly known as a CPAP or a BiPAP, earlier in your diagnosis, which may improve lung function, decrease your shortness of breath, and improve your quality of life. And you have options. Only you can decide what is right for you, and there is no right or wrong decision. And you can change your mind as many times as you want to. We're all entitled to change our mind. So the photos in these next 2 pages are featuring Independence Plus patients and their nurses. These patients that we have on here all had private duty nursing with our organization as well. So we provided the equipment, and they were all lucky enough to have a private duty nursing benefit or be able to afford a private duty nursing benefit. There is advanced technology and home care services designed to maximize your quality of life. And many people with ALS continue to live full lives at home for years post-diagnosis. Over the past 41 years, we've had the honor of providing care for people with ALS who have continued to be very active in their communities. They've continued working. We're a little bit ahead. That's me and Harry. Sorry. I'm running out of time. I'll speed it up. But they've continued with their jobs for months and sometimes years. They've attended functions such as Lollapalooza, baseball games, class reunions, family functions, traveled to different states, and church, among other things. And then the center picture in this slide is one of our patients, a very energetic and inspirational man who I had the privilege of transitioning home when he was diagnosed with ALS. His name is Eric, and he kept a blog detailing his life with ALS, which he battled for over a decade. And if you would like to read his blog, which showcases his very witty sense of humor and dedication to raising awareness of ALS, there's a link at the bottom that is shared, and you can. There's also a link for Q&A with Eric. He authored the blog called "Fight Like a Champion." Next, I would just like to thank you for your time. Should any of you wish to reach out to me separately with questions, either through email or phone, I'm happy to help and talk with you at any time. Sometimes just having someone to talk to is all you really need. I know I felt very isolated when my son was first diagnosed, and again, he's in the rare genetic disorders, so there wasn't great organizations like the ALS Foundation where I could talk with other people similar, and I really would have enjoyed talking with somebody. And not that I'm in the same situation, I'm in a similar situation, and I'm always here for you. So it's my passion, my motivation. I consider it my reason for being, is to help people. And here on the last page is Harry and I just having a snuggle on the bed, one of his birthdays many years ago. And earlier on, the last photos over a decade ago, going on the Chicago River, where I was the captain of a boat. So that was quite fun. And I just want to say, as a parent, as a human being, there are no right or wrong choices that you're going to make. There's only doing your best every day. And quite frankly, never giving up hope. Hope is all I have some days, hope and faith. and never stop trying. We're all human. We're often called to make decisions that will not change the fact that sometimes life isn't easy and it requires us to make painful choices. My role as a complex care patient advocate is personal. I've dealt with confusing medical systems, and I know that it's challenging to navigate. And I just want you all to know that I will be here for you truly at any time. There will be good days and there will be bad days. It's important to lean on your friends and your support systems. Please don't hesitate to reach out. And thank you for the honor of your time. I truly appreciate it. Thank you.
Thank you so much, Anne, for your thoughtful and informative presentation. Q&A box is open and is welcoming any questions you may have. We will go through them at the end of the program. So if you have any questions, feel free to share it in that box.
The only questions I see are from Charlie. Let me scroll down.
What percent of ALS patients
Okay.
facing pending respiratory failure choose invasive ventilators, in your opinion, in your experience?
Okay, so I believe right now it's less than a fifth of 1% of ALS patients choose. Do you want me to type this or speak this, Joumana?
Yeah, speaking it is perfect.
Okay. Very few patients are opting to go the route of getting the tracheostomy tube and invasive ventilation. I believe the statistic is less than 0.5% right now. Healthcare trends, shockingly, do occur in trends, just like fashion trends. And there's a period where more and more people do seem to be getting trachs and invasive ventilation, and then it drops off. What I think is being promoted primarily right now for patients with ALS is to opt for the palliative and hospice route. I'm happy to speak with this anonymous attendee to address any questions they have specifically about trachs. My phone number and email are on the presentation. I can give it again here. My phone is area code 708-738-5766. And I'd be happy to speak with you more specifically and answer any questions you have with regards to trachs. And the reason I spoke so much about planning is because without plans, things are done emergently. If you were not really wanting to get a tracheostomy tube or an invasive ventilator, and you did not have any advanced directives in place, and you were at home and you became very short of breath, and you dialed 911, they may be sticking the endotracheal tube down your throat in the ambulance on the way to the hospital. And then you're in the ER, they're stabilizing you, they're going to move you up to the unit. And if they can't wean you off the ventilator, after 14 days of that endotracheal tube being down your throat, they have to make a decision to either remove the endotracheal tube and put in hospice and palliative measures, or you get the tracheostomy tube in your throat. The endotracheal tube can't remain in for more than 14 days. And I've heard many people say, well, this isn't what I wanted. If you don't have advanced directives, if you don't have a plan in place, if you don't have that paperwork all written out and it doesn't travel with you, this unfortunately happens quite frequently. And then you have a tracheostomy tube and you're on a ventilator and you're in a facility and you don't have caregivers to support you in the home, and you don't have private duty nursing benefits in the home. And you really don't want to live this way, but you're already in this situation. So then you're forced to make a decision. Do you want to continue to live life this way in a facility, trying to get people in the home to be able to support you? Or do you want to choose the hospice and palliative route? So I apologize if it felt like it was too much talking about planning. I've seen the opposite side of not having plans in place and people living with the realities of that.
We have another question that addresses why you speak about the 24-hour care is needed. Well, I can say for that, especially in advanced cases where you cannot use your arms or hands to adjust the tube, you need somebody to be there at any moment. And also for suctioning and grooming and all that stuff. So it is important. You cannot be left alone just in case the respirator gets disconnected. It's very important that somebody is there to help. I hope that answered the question. And we have another question that says, how do you talk to palliative care who seem to be not in favor of trachs? Basically, and I think you can also speak to that. Insurance companies do not technically cover, maybe palliative care, yes, but not hospices. They do not cover those services along with the trach because it kind of defeats the idea of having hospice. Hospice is supposed to provide comfort, not extension of life. Palliative care companies that are working with the person, they may tend to have an opinion because they probably do not want to deal with that, possibly.
If I may comment as well while
Please
we're
do.
waiting, Joumana, with
Please.
regards to palliative versus hospice. So palliative care can be in place while a patient is on a ventilator with a tracheostomy tube. Palliative care is comfort measures. I would highly recommend that everybody start having a conversation if you're going to get a if you're going to get a trach or you're not going to get a trach, if you're going to get a ventilator or you're not going to get an invasive ventilator, start having conversations with a palliative care provider to find out what types of services they can offer you. Hospice is different. You can have hospice and palliative together, but hospice means no extraordinary means to extend your life. So if you're going to opt for a hospice and you have an invasive ventilator, the amount of time they're going to allow you to remain on the ventilator is going to vary based on the hospice provider, but it's typically not more than a month or two to say your goodbye to your families, friends, and loved ones, because that is extending your life through extraordinary means.
Now we're gonna present our next presenter, our famous Charlie Wren. So this next presentation is titled Choosing to Keep Breathing. One Man's Journey with ALS Ventilation, presented by Charlie Wren. Charlie was diagnosed with ALS nearly 11 years ago and has lived with a tracheostomy and a ventilator for eight of those years. Before ALS, Charlie worked as a heavy-duty mechanic and also was a part-time musician. With his symptoms began in his hands and arms, and today he communicates using eye gaze technology and remain connected with the world around him. Charlie chose invasive ventilation so he could see his children grow and graduate high school. And tonight he will share what went into the decision, what daily life and with a trach and a ventilator is truly like, and what he wishes others knew when facing similar crossroads. Charlie, thank you so much for being here and for your generosity in sharing your story. I will now turn things over to you. I think it may be less stressful if we can ask Charlie to send us the video, and then we'll try to figure it out and we'll send it in the email follow-up afterwards. We don't want to take too much time of your day, and we are very sorry about that. But before you go, we wanted to make sure as we wrap up today's webinar. So Charlie just confirmed that he will send it. So we will send it in the follow-up email. So as we wrap up, I want to offer my deepest thanks to Charlie for trying so hard and Anne for sharing both their expertise and their hearts with us. These conversations are never easy, but they are so important. We hope tonight's discussion provided clarity, perspective, and reassurance to those navigating ventilation decision now or in the future. Thank you to everyone who joined us from across Illinois, Indiana, and Missouri and beyond. On behalf of ALS United, we are honored to walk alongside you. We will follow up with an email that will include this recording and any unanswered questions by the end of the week. Please take good care of yourselves and have a wonderful rest of the evening.